Hello, you are welcome. Today we are discussing postoperative nursing care. So this postoperative nursing care is a general nursing care. It's not specific. Remember, the postoperative care can be different according to the type of the condition that the patient had, the type of surgery done, and the type of anesthesia given to the patient. So I'll define postoperative care like this. Postoperative care is the nursing care given to the patient after undergoing surgery. Postoperative care starts with the patient collection from theater and continues on the ward. Here are some of the aims of postoperative care: to promote patients' comfort and pain relief, to prevent postoperative complications. There are many more aims. Receiving the handover from the theater nurse. I will carry necessary equipment like a vomiter's paw to be used in case the patient vomits. Also carry vital signs tray. Sometimes you may find the vital signs tray in theater, so you may use it to check the patient's vital signs. I'll get the handover from the theater nurse on the patient condition, type of surgery performed, type of anesthesia given, estimated blood loss, total intake of fluid, and output of urine during surgery. After getting handover, I'll observe the patient's airway patterns. I'll do the vital signs and also check the level of consciousness. And I will transfer the patient to the ward while observing the patient's condition. Remember, when you are transferring a patient to the ward, you will be at the head side of the patient in order for you to observe the patient easily. On the ward, I will admit the patient in acute bay for close monitoring with the following equipment within reach: oxygen source, which can be oxygen concentrator, oxygen cylinder, suction machine, vital signs tray. You may also include the drip stand and other equipment that may be needed during resuscitation. Then I will nurse the patient in an environment with good lighting for good observation. And you can also nurse the patient in a clean environment to prevent secondary infection. Airway. I will position the patient in supine position with head tilted on the side or lateral position to prevent aspiration if secretions are present. I'll suction the secretions to clear airway. And on breathing, I'll observe the patient's rise and fall of the chest in order to monitor breathing pattern. I'll administer oxygen therapy to promote tissue perfusion if the SpO2 is low or the patient is dyspneic. I will check the patient that is under circulation. I will check the patient incision site to observe if there is bleeding. I will observe the color and feel the temperature of the hand and the fingers to monitor circulation. I will check the patient's blood pressure and pulse to assess the signs of shock. I will check the patient's oxygen saturation to monitor patient's tissue perfusion. Now come to wound care. I will do daily wound cleaning with prescribed antiseptic solution. This will be done after the first dressing has been changed by the surgeon. Remember, the person who has done the procedure, the surgeon who has done the procedure is the first one to remove the first dressing because he's the one who understands that wound. On hygiene, I will do bed bath initially to promote hygiene. As the condition improves, I will do an assisted bath. Then I will change linen whenever they are soiled in order to promote patient's comfort. On exercise, I will help the patient do passive exercises to prevent deep vein thrombosis. And I will encourage the patient to do active exercises such as deep breathing to prevent conditions like apostatic pneumonia as the condition is improving. You can also encourage the patient to do an early ambulation in order to promote good circulation of blood. On observation, I observe vital signs, that is temperature, pulse, respiration, quarter hourly, okay, for 2 hours, or depending on how the patient is responding, then half hourly, then hourly as the condition improves. Then I'll observe the patient's level of consciousness. I'll observe the amount and color of urine to monitor renal function. I'll observe the amount and color of drainages from the wound. Pain relief, I will administer prescribed analgesia to relieve pain. Then as the condition improves, I'll provide diversional therapy to divert patient's mind from pain. Then I'll position the patient in his or her comfortable position to promote patient's comfort. Then on nutrition, I will initially keep the patient nil per oral as per doctor's order. Then after bowel movement begins, I will give the patient sips of water and later food diet as per doctor's order. So these are some of the points that may be needed in post-operative care. Remember to compare this information with what the lecturers or the tutors are teaching in order to have a better understanding of post-operative care. Here are some of the complications of post-operative that happen during post-operative period. Okay, so there's a wound infection. So the wound might get infected. And how do we prevent that? You follow aseptic technique when doing procedure in theater. Also, you follow aseptic technique when doing wound dressing. You give the patient prescribed antibiotics. You discourage the patient touching the wound with dirty hands. And you also give an IC on how to take care of the wound when they are discharged from the hospital. Okay. Other complications may be hemorrhage, can be there. Okay. This may be because of maybe the suturing wasn't done well. Okay. So there will also be hypostatic pneumonia, wound separation. So these are just some of the complications of the post-operative complication. So thank you very much. Remember to study more and remember to compare information with what you learn in school. For this channel is not a substitute for school and the hospital. Thank you.